everyone, and welcome to this academic session of the MSc program in Counseling and Family Therapy, wherein we are going to focus on two aspects. The first one is marital and family therapy. And delivering a talk on this topic is Professor Ahilya Ahuram, who's here with us today. Thank you, ma'am. She's a professor at NIMHANS at Bangalore. The other aspect that we are going to cover is the potential of counseling and family therapy in tackling mental health disorders. And to talk on this topic, we have with us Dr. Jitendra Nagpal, who's a senior psychiatrist at Moolchand, and he looks after the mental health and life skills education aspect in his course of work over the years. So in this particular session, we are going to let the two speakers make their address, and thereafter the floor would be open for interaction with the participants in the program today. So first, let me request Professor Ahilya Ahuram to talk on marital and family therapy.
Thank you. What I would be doing is to give you an overview of family and couple therapy, which is in some ways a huge task because each of these are two really large and vast bodies by themselves, which can be talked about at length, but however I would try to cover it in the time allotted to me as briefly as possible and at the same time as comprehensively as possible. Now, the perspective that I would also be adopting in this talk is, on the one hand, to give an understanding from the clinical perspective, which is to say, how do we actually go about practicing family and couple therapy? And at the same time, since in these days of evidence-based medicine, we cannot necessarily only go by people's experience or their word that a particular method or a technique works. We need to back it up with evidence. Therefore, I would also be touching very briefly on what some of the major findings with regard to the efficacy of couple and family therapy has to say regarding the utility of these methods. Now, we all know that relationships with people are an inevitable and at the same time a rewarding part of our lives, of our day-to-day lives. We are constantly surrounded by relationships, and as Dr. Girishwar Mishra mentioned earlier, the fact that we live in a collectivistic culture means that we are constantly surrounded by relationships. We define our identities in the context of some significant relationship or the other that we have in our lives. And therefore, it occupies a very central place in most people's lives. Most definitions of mental health also emphasize the fact that stable interpersonal relationships are an essential component of mental health. And in fact, mental health and interpersonal relationships in some ways share a bidirectional relationship. That is, if we wish to have satisfactory interpersonal relationships, we need to have sound mental health, which means in some ways an absence of depression or excessive degrees of anxieties or other insecurities. And at the same time, having sound mental health in many ways contributes to the quality of the interpersonal relationships we have, and it's important to keep the fact that there is this bidirectional relationship between them. At the same time, given the fact that lifestyles are changing so rapidly in our society and at the level of individual families as well, most relationships in our lives are undergoing considerable strains and pressures, and this has led to an increase in the number of clients who are actually presenting with issues of an interpersonal nature. In fact, when we look at what is the nature of the presenting problem with which clients come to us, even though they may come as individuals, when we actually probe into what is the reason for their having sought help, many times the problems that they talk about are interpersonal in nature. Therefore, it does seem that interpersonal conflicts and interpersonal issues are becoming much more important and are becoming an important reason for people to seek help from counselors and therapists. With that, I will move on now to first talking about family therapy, and then later on I would go on to discussing couple therapy. Now, family therapy is actually a specific way of thinking about human behavior and problems, and this specific way actually refers to what is known as the systemic approach. The hallmark of the systemic approach is that, in contrast to our understanding of individual psychopathology, which is linear in nature, which is to say that we identify a set of factors and we believe that the existence of these set of factors leads in some ways to a certain kind of an outcome. The systemic perspective moves away from this kind of a linear thinking to what is called a circular way of thinking about problems. It highlights the fact that essentially relationships are recursive in nature. That is to say, if A and B are interacting, the way A responds to B has an impact on B, which generates a certain kind of response from B, which in turn has an impact on A, and so on, and therefore this kind of a cycle goes on. And the focus in family therapy is to try and unravel this recursive pattern rather than focusing on just the individual alone. At the same time, family therapy also consists of a set of therapeutic techniques which have been identified as being useful for dealing with distress in families. Now, what are the kind of problems or the nature of problems that present to family therapists? The most obvious are the interpersonal difficulties between various members of the family, and these can include difficulties between parents and children, or between siblings in the family. At the same time, it also includes a very large percentage of families where the primary problem lies with the couple, which is to say the marital problems, and these include sexual difficulties and issues of infidelity as well. All these are problems which are generally seen by family and couple therapists. There are also another set of problems, and these are problems due to ongoing stressors. Now, these ongoing stressors can be in the form of serious mental disorders, like having to provide care for a person with schizophrenia, or it can be ongoing problems such related to the use and abuse of alcohol and dependence on alcohol and other substances. It could be chronic stressors due to developmental disorders in children, such as autism or other developmental delays like mental retardation and so on, or of late, more chronic medical conditions such as, for instance, chronic renal failure, or an individual who has cancer which requires prolonged treatment and caregiving on the part of the family. Now, all of these can work in ways to affect the routine functioning of the family, create stress for various members which they may not be able to cope up with, and therefore lead to difficulties between family members. What are the different approaches to therapy that are adopted by family therapists and couple therapists? As far as the various theoretical schools are concerned, they would include approaches that are based on psychodynamic theory, the systemic theory that I've already mentioned, the structural school, behavioral methods, and of late, methods such as the emotion-focused therapy, solution-focused therapy, and the psychoeducational approaches. So, family and couple therapists really have a wide armamentarium of different theoretical perspectives and techniques based on these perspectives which they can employ in dealing with their clients. Coming to the stages of therapy as such, the Stages of therapy obviously would include, in the initial stage, the process of intake and assessment. The intake process is particularly important because, especially in our culture, most people seek the help of a counselor when one member of the family has developed a problem or a dysfunction which is severe enough to warrant seeking help outside of the family. And therefore, when the counselor or the therapist informs them that the involvement of other family members is also going to be required, there is always a certain amount of confusion and skepticism about that. And therefore, it is important that they are help to understand the rationale for involvement of all of them in the process of therapy. I will be coming to the different aspects of assessment in just a little while. Following the process of assessment, the therapists need to formulate their own hypothesis, which is really a way of putting all this information that they have gathered together in a systematic manner, which helps them to understand what are the factors that have given rise to the problems and what are those factors that are operating within the family which are serving to maintain the continuation of the problems in the family. Setting goals for therapy, which is then followed by the actual middle phase where, in collaboration with the therapist, the family or the couple works towards achieving the goals which they have identified and therefore leading to a resolution of the problems for which they sought help, and finally the termination phase. What does this assessment phase consist of? Because we are dealing with a group of individuals, naturally we need to be aware of the fact that although one member of the family may have an identified problem, yet different family members can each have an individual perspective about the same problem, which may not always be identical. And therefore, it is important for us to understand what are these different perspectives that each family member has about this particular problem. But apart from that, what are the other dimensions of the family's functioning that we need to evaluate? One, we need to evaluate what is their process of decision making. Is there a democratic process involved, or is it is it a system where there is a more unilateral way of making decisions? What is the distribution of power in the family? In our culture, more often than not, it tends to be gender specific, which means then that male members are likely to be in positions of greater power. What is the nature of roles that are present in the family, and what is the level of performance and accountability and satisfaction with the performance of these roles? What are the types of communication patterns that exist in the family? And very importantly, what are the adaptive processes and the adaptive skills that the family has? For instance, to solve problems of a day-to-day nature, what skills do they have to resolve conflicts or differences of opinion when they arise? What kind of methods are used? And what are the kinds of supports that they have to which they can reach out to when there is a requirement? And finally, what is the degree of cohesiveness or a sense of we feeling or a sense of bonding that all the family members have? Once this assessment has been done, in general, family therapy tends to have certain broad goals which in a way cut across different kinds of problems, and of these the goals include, obviously, firstly, to decrease painful and unrewarding interactions that go on repeatedly within and amongst family members, and thereby to reduce their distress. To improve communication so that it becomes more open, free and honest. It is amazing when we evaluate families to find what are the modes of communication that families get into when there is a disharmony between them, and the very indirect methods that sometimes come into existence. We also need to have as a goal the enhancement of individual satisfaction in the relationship of each member of the family, which means then that our goals have to ensure that all members of the family ultimately feel satisfied with the outcome of our intervention and not just one or two members. And to facilitate, very importantly, the acceptance of differences between family members and particularly acceptance of each other's weak points and vulnerabilities. And in that process, what we would actually be achieving is enhancing the family's ability to accommodate to a much greater degree than they were doing earlier. However, these are broad goals, and when we are dealing with an individual family, they have to be contextualized and individualized to suit the individual or the unique presenting problem with which each family comes for help. In the initial stages, we need to set ourselves some short-term goals. And what do these short-term goals consist of? One immediate goal that the therapists need to achieve is to shift the focus and the attention of the family away from this identified individual to looking at the problem as something that affects all of them, and therefore which requires intervention to involve all of them. To develop a strong therapeutic alliance. This is easily achieved when we are dealing with an individual or a single patient, much more difficult to achieve when you have 4 or 5 members sitting in the same room and the therapist trying to establish a therapeutic alliance with each of them. Therapist has to ensure that there are equal opportunities for participation of all the family members in the therapy sessions, because the usual tendency is for one or two of the more vocal members of the family to monopolize the time in the therapy session and to act as the spokesperson for the entire family, which is something that needs to be discouraged. Enhance the motivation for therapy and foster a sense of hope and optimism, because many families actually come for help after having attempted to cope with the problem and attempting to deal with it with their own resources for a long period of time. And therefore, when they come, many of them are fairly skeptical about whether therapists will actually be able to achieve any change or make a difference. And therefore, it's important in the initial stages to enhance their motivation to stay on in therapy long enough for these changes to become evident, and throughout that process to maintain a sense of hope and optimism for a positive outcome. In terms of the long-term goals, obviously the therapy needs to focus on resolving the presenting problem for which the family had initially sought help. One of the long-term goals that therapy should achieve is to decrease the urge between different family members to punish each other. Now, when there has been an atmosphere of acrimony and very strong hostile feelings between members, very often there is this urge to take revenge or to punish various other family members in different ways. One of the things that the therapy must achieve is to decrease this urge to punish and to help family members realize that this is really futile and it is not going to help them in terms of resolving their problems. This is done by encouraging forgiveness in the relationship, which will then ensure some degree of reconciliation between the members. And once this reconciliation is fostered, then it is possible for family members to actually move on to develop a greater degree of intimacy amongst themselves and a better sense of cohesiveness between themselves. We must understand that resolution of the presenting problem does not automatically mean that the family is going to be a happy family. All that it means is that we have got rid of something that was bothering them or irritating them. From that standpoint, we need to get the family to move towards the positive direction of building healthy and intimate relationships, which is part of the long-term goals. Now, what does the research in family therapy have to say regarding the efficacy of family therapy? Firstly, one of the things that is evident is that although there are so many different schools that I had mentioned earlier, in fact, there appears to be a great amount of integration between all these different models. So, it is perhaps not very common to find therapists who are using any one single model in its very pure form and applying it to families. Most of them perhaps tend to use an integration of more than one or two models. Research today has also acknowledged the fact that there is a great need to look at other ecological factors in the causation of problems. Whereas earlier research would look only at the intrafamilial factors, today the research focuses on factors outside of the family, such as, for instance, a family that is living in a great deal of economic hardship, or a family that has relocated from one country to another, or a family that is living in very unsafe neighborhoods. Now, all these are factors which can create a great deal of tension and pressures within the family, but so far these had not been addressed, which research is currently beginning to look at. What research also points out is that family therapy definitely seems to be effective for a very wide array of problems, and in comparison to couple therapy or individual therapy, it seems to be focusing on more diverse and more difficult and chronic problems. As far as predictors, what are those factors that predict a good outcome in family therapy? One, when the therapist, as I had mentioned earlier, if the therapist is able to shift the locus of the problem away from an individual to the family as a whole, this seems to predict a better outcome. When very early in the sessions, that is to say in the initial sessions itself, if the therapist is able to bring about a significant reduction in the extent of negative or hostile feelings that are expressed within the sessions, that leads to better outcomes. When the therapist is able to achieve improved behavioral and interactional competencies between different family members, when there is treatment adherence, when the therapist is able to resolve deadlocks and impasses that are very commonly encountered in family therapy. After all, it requires a tremendous amount of negotiation skills on the part of the therapist, as well as a willingness to move away from very rigid positions by the family members in order to become more accommodative. And therefore, if the therapist is able to achieve a resolution of these kinds of blocks in therapy, that leads to good outcomes. And finally, the importance of the therapeutic alliance between the therapist and the different family members. Now, with that, I'll move on next to talking about marriage and the different aspects of couple therapy. As far as couples are concerned, the same dimensions of assessment that I had mentioned earlier have to be looked into, but in addition there are a few that are specific to couples. One of them is to look at what are the expectations that the couple had at the time of marriage of each other and from marriage itself. When they are seeking help, what is the extent of their commitment towards continuing their relationship? To what degree are they willing to put in efforts to make changes? What is the level of hostile feelings and anger that is currently being expressed? And are they able to perceive any positive attributes at all in their partners? These are certain additional dimensions which need to be assessed as part of our initial sessions itself. Now, usually marital discord seems to arise when one partner attempts to engage in a problem-solving discussion while the other attempts to withdraw or avoid getting into these discussions at all. And this is a fairly typical pattern that is encountered. Also, when there is a use of pressure or demanding behavior or coercive methods or the use of threats in order to get the partners to agree to whatever are the issues. These two patterns are definitely seen to underlie the genesis of many of the problems between couples. And thirdly, when there is a higher status and power accorded to one partner, which leads to a considerable degree of resentment on the other, and this is likely to be present in some families where there is an adherence to much more traditional values. So what are the indications then for marital therapy? Firstly, when spouses recognize that there is a problem in their relationship. But the other indication could be when there are emotional and behavior problems in children. And very often, when an inquiry is made into the background of the problems in children, one frequently identifies that the real problem is the problem between the parents. When there are sexual problems or lack of satisfaction in the sexual domain between the partners, and very importantly, when there is a failure or a lack of progress in individual therapy, then this is often an indication for couple therapy, and when there are issues of infidelity involved. Again, coming to the research on marital therapy, what the research again demonstrates is the fact that there are positive and reliable changes that are demonstrated in groups that have been treated with couple therapy as compared to groups that are put on wait list controls or whatever. But the interesting fact is that irrespective of whatever may be the particular school or the particular model of therapy that the therapist may choose to use, there are comparable outcomes across all these different methods, which means that no particular approach seems to be superior to the other. All of them are equally effective when employed by someone who is skilled and well trained in the use of a particular method. That is what the research seems to be suggesting, that there are clinically significant improvements that occur in at least 50% of couples who are treated with couple therapy. But unfortunately, many times this change is often not sustained in the long run, because in about 2 to 4 years' time, at least 1/3 of the couples who have undergone therapy and who have shown improvement do seem to relapse. So this just highlights the need that perhaps one should not just be satisfied at having an immediate positive outcome at the end of therapy, but instead plan for some kind of booster sessions also, so as to keep the motivation of the couple going. Poor outcome is noted in those who present with higher initial levels of distress, particularly when there is depression in one of the partners, when at the time of presentation for therapy itself, there is a degree of emotional disengagement that has already taken place, and when the relationship is characterized by a very rigid adherence to traditional gender roles. And what is of importance to therapists is when they attempt very premature problem solving, which means as therapists, we should be cautious about not rushing into providing solutions too early in the therapy. This can often lead to a poor outcome. I'd just like to highlight a few key issues in therapy across both family as well as couple therapy. One is to develop positive expectancies in the couple or in the family. And this is extremely important, because it is only once that there is this sense of a positive expectation from therapy that they are also motivated to continue, and then it can lead to a positive outcome. Therapists should try to keep their focus on the strengths in the relationship. far too often therapists tend to focus only on the conflicts or the problem areas. Therefore, it is important not to lose track of what are the strengths also that might be present in the relationship. The third important aspect is to have a collaborative relationship between the therapist and the family or the couple. This is because the couple or the family also needs to be aware of the fact that they are responsible for resolution of the problems, and the whole responsibility does not lie with the therapist to find solutions, and this is important. Of course, adopting a non-judgmental stance is extremely important. The key factor is the issue of therapists being neutral and at the same time being empathic to each and every member of the family. This is, I think, one of the biggest challenges in both couple and family therapy. It is very easy to be empathic when you have one individual sitting in front of you. The whole scenario changes when you have two people sitting. You cannot help in some ways aligning with one or the other of the partners, and usually this unconscious alignment is determined by one's own gender or by one's own values or age and so on. And therefore, therapists need to be very, very much aware of their own tendencies to align with one or the other of the family members. And this is why they need to be very much aware of their own values and belief systems. What has also been found in recent times is that there are promising results found for programs on marital enrichment and programs that focus on providing premarital education, which can contribute to prevention of discord. And I think in our country, this is going to be an emerging need in the very near future, because you do find that youngsters are getting into relationships very often without necessarily having the skills to know how to negotiate these relationships or to negotiate their lives after a breakup of the relationship. And therefore, some kind of an input or an education which is targeted at providing them with premarital, I wouldn't even like to call it premarital, it is more about relationship education. How to have more realistic expectations out of a relationship and how to negotiate differences, how to resolve conflicts. These are things that perhaps young people actually need to be educated upon, and having these kinds of programs has been found to have beneficial effects. I would just like to conclude with the words of George Bernard Shaw, in which he said that the greatest service that one can do for an individual or for a society is to bring up a good family. Because once you have that in place, many of the other related problems can be prevented. Thank you.
Thank you, ma'am. So the house is now open for interaction. Any comments, any questions, you are welcome.
In North India especially, there are many joint families, and many times the couple therapy or marital problem between the couple is also because of interference of in-laws. So how do you address these problems in your therapy?
Two ways in practice that we address this. One, if the couple is a newly married couple, in fact, because I didn't have the time to go into it, Minuchin has in fact talked about it, described it very beautifully in terms of what are the tasks of marriage. That is to say, what are the tasks that a couple has to achieve in the initial stages of the marriage. And one of the things that he has emphasized is that there should be a healthy separation of both partners from their respective families of origin, which should also be supported by the families. Okay, because this is what will help a newly married couple to invest in their new relationship and develop a strong emotional bonding between them. Therefore, if a couple comes in the very early stages of marriage, and sometimes we have had couples coming 1 month after they have got married, often we find that the issues are related to their being unable to healthily separate out from their families of origin, and usually in these cases you also find that the families are also somewhat unwilling to let go. Therefore, what we try to do is to first work with the couple, get them to establish their own marital unit, get them to start feeling more comfortable with each other and develop a strong emotional bond between them. And in this process, we also fairly explicitly tell them that for the time being, they need not go back to their own families for resolution of each and every small problem. Instead, they need to look on the therapy sessions as a way of resolving their difficulties between them. And this, we find, generally works out pretty well. Once the couple is given time on their own to develop their own marital unit, they are able to carry on quite successfully thereafter. But in couples who come after several years of marriage, where there are ongoing issues with in-laws because they are staying as an extended family and so on, we then have to negotiate with the couple to try and see whether we can involve the members of the extended family also as part of the sessions, in which case we would then probably use a combination of both couple therapy sessions as well as family therapy sessions, a combination of both.
Ma'am, when we are talking about couple therapy, in that perspective, generally two institutions coming to play, marriage and family, and we are simply, our attention is totally diverted to marriage and family. But in metros, more and more live-in relations. So in that context, this couple therapy techniques, theories and tools is applicable, or we have to reinvent something else to deal with the stress and strain live-in relation situations?
Yeah, that's I think an important question, and I think also especially in light of this recent Supreme Court judgment also. Frankly, at this point of time, I cannot answer that in a very categorical manner. It is possible that some of the approaches and principles may apply to live-in relationships as well, but in the long term, how effective they will be is something that we really have to test out. We don't know really, because we do have a handful of people who have been in relationships, in long-term relationships, who have come for help, but I'm not sure whether there is too much of research or empirical evidence to say what has been the outcome of applying all these methods.
Madam, this problem, relationship problem, it is mainly in metro cities. But how these facilities can be available in the rural areas or the smaller towns or the district level? How this can be obtained there?
I beg to differ with you on that issue, because definitely in smaller towns there is no dearth of relationship problems at all, because the pace at which the country is changing is such, and plus the wide reach of cinema and the media is so much that today in some ways it is almost like a norm for anyone who is a young adult to be in some kind of a relationship. The forms in which these relationships are expressed may vary in the metros as compared to smaller towns and rural areas, but I think it is there everywhere.
Regarding when there is a joint family and you live with your in-laws, and the problem comes from that. And I want to show things from the other side. When it is your own family and your children are causing trouble, and this become a trouble between the parents, some form of disagreement it starts with, and now the emotional trauma, and you have spoiled him, you have spoiled a piece of the family, everything goes on, a big mess comes up. And it is true, as you have addressed in your talk, that it comes in the form of the problem of children, and you dig it up and you find that no, it's between the parents. How to address this?
This is something which is really a very, very typical situation which calls for family intervention. In fact, in the West, this is the context in which family therapy developed in the first place. because in order to address problems of children and particularly adolescents, wherein the root cause was very often the disturbed environment in the family as a result of discord between parents. Okay, the difference is that in India, in the West, when there is a severe degree, or sometimes not even a very severe degree of discord, it is very easy for families to break up. The couple simply divorces. In India, problems manifest themselves in a fairly severe fashion, mainly because in spite of differences, the couple somehow struggles to stay together, which may not always be a very good thing. Because for a child to grow up in an environment which is characterized by so much of hostility and sometimes physical violence or all other forms of a very disturbed environment is not at all a very healthy environment. Therefore, a situation like this will definitely call for family therapy. Here again, what we would usually tend to do is to use a combination of different types of sessions. So we might have some sessions in which issues that pertain only to the couple are addressed. There are some issues which will involve the adolescent or the child and the parents, and there might be some individual sessions for the child alone. So when we use a combination of these different combinations, it usually does produce good results.
Thank you very much, ma'am.